room before we get to tomorrow news. And we've got Dededo Mayor Melissa Savares. Good morning, Mayor. Unmute, please.
Unmute.
Good morning.
Hi, Mayor. Well, we wanted to bring you on because you're the mayor of the largest and most populated village in the island, and we're now going to be partnering up with the mayors to get people at the village level tested because, well, when we talk to the Mayor's Council president, the idea seems to be that there's a lot of people who aren't reachable via social media videos or whatever type of messaging that we were doing before. People who don't have insurance, don't have a doctor, don't have a clinic, and these are the people who are dying at home. And so they're enlisting the help of the mayors because you guys know your constituents, you know your village, to do testing at the outreach level. So that's where we're at. I guess just your reaction, is it feasible? Can it be done in Dededo?
Well, there's we have the Northern Community Health Center. It could be done. We have several private clinics here, and I know that some of the things were like the discouraging lines in Tizen, and then plus people didn't have. Not everyone who has flu symptoms, had the access to transportation to go to line up at Tizen. So. Yes, it could be done in Dededo. Of course, the message continues to go out as we go out into the community that if because it's flu season, everybody, like Dr. Wen had said, everybody thinks they just have the flu. But our message with the Mayor's Council is that no matter what it is, if you just don't feel well, go and get tested. We have several, like I said, several private clinics are accessible. The testing is free, and this will prevent any spread of COVID within the families, the family units. It's better to be safe than to, be a DOA or to spread the virus to your families.
What about your staff? I mean, you guys are lucky because you're right. You do have the Northern Public Health, but Mayor Alligat said that there was something that was discussed in the meeting about training the mayor's staff to be able to test people for COVID-19.
I don't feel comfortable. Yes, it was discussed, but I don't feel comfortable having my staff do the testing. We have 2 senior centers. We're feeding seniors. We take care of the normal routine operations of our office, and being a large community, I would rather just have people go to the nearby facilities. And like I said, it's not necessarily a facility run and operated by Department of Public Health. We have some private clinics, and testing is free.
Is there anything else that the mayors are being tasked with, or should I ask, what are you guys not being tasked with?
The mayors are we're a resource because we are frontline. We're a resource for our community. Should anyone need transportation, we will make arrangements for someone to go to a facility to get tested, or we will work with the Department of Public Health outreach nurses who actually do homebound vaccination to maybe go out and identify an area for testing should the need arise.
What do you make of the budget? It's much different than previous fiscal years, and so now it seems there's going to be more fairness or equitableness in the budget and the way that the amounts that are distributed to village mayors, and it would seem that the Dededo mayor's office would be getting a bigger budget than you have in the past.
I haven't seen the exact numbers, but that's what we are here. We've been told is that, of course, it'll be a little more equitable to the larger communities and not just Dededo, Jigo, Tumuning, and Manilao as well. So I'm happy with that. because when things are equally divided, it's really, really difficult. We had a very difficult time this fiscal year, and so with operations, there was a lot of restrictions that we had to be very honest with our constituents when they demand, when they requested for other services. And then one of the things was like funeral escorts. We only did escorts, because of our fuel funding. We only did escorts from the place of service to the burial site, the final resting place. We didn't do escorts from the viewing site to a place of service and then maybe pass by the residence. We didn't do all those extra, parts of the funeral escort. It was strictly one way only. So those are other things. We understand that we will be getting, for road maintenance a little bit more because of our mileage, road mileage.
Yeah.
So I'm very happy with that.
All right, Mayor. I know we very rarely get to get you on the
Yeah.
show. Is there anything else you'd like to get out? I guess specifically with Dededo.
Well, we just, I know that a lot of our schools are already working with their families on their school schedule. Some are still with online, but alternating grade levels or family units. But the online, there are some families that are still struggling with online. Of course, we continue to work with GDOE to assure that things for the students are going to be, the services for the students are going to be priority. We continue to take care of our seniors. And this being the end of the fiscal year, we look forward to more recycling revolving funds, assisting with removals of more of our abandoned vehicles, tires, and white goods in the coming fiscal year. So, we just ask our families to please be patient. Eventually, I know some, are struggling, but that's something that we learned through COVID is patience, and we eventually will get to taking care of some issues in the village. So thank you.
Well, thank you, Mayor, for everything you're doing and your staff as well. We know you're going above and beyond a lot of what your original responsibilities are. So thank you so much.
Okay. All right. God bless and have a safe day.
Okay,
You
stay
too,
safe.
Mayor. We're going to take a quick break, and we're coming back with the Division of Environmental Health, Public Health and Social Services.